Hi, good evening, everyone. Thank you for coming. My name is Brittany Fody. I'm the Licensing and Level of Care Administrator for Children and Family Services. We also have Dana here, and I'll let her introduce herself here in a little bit. I just want to go over some housekeeping items for everyone who is on. This presentation will be recorded and will be put on the Children and Family Services Training Center website by next week. Training hours are available for foster care providers, and the training center will notify your licensors if you have attended. Please be aware if you are a two-parent household, if you can change your name on Zoom, or if you don't know how to do that, can you please put who else is attending in the chat? Also, if you don't have your last name, can you please put who is attending, first and last name, who is attending, so that we can get those licensors notified of attendance. At the end, there will also be a survey for each attendee that will come from UND. Please fill out if you are able to. Also, please feel free to place any questions that you have in the chat, as we will not be allowing folks to unmute due to time. Dana, I'll pass it over to you to introduce yourself.
Thank you, Brittany. Good evening. My name is Dana Lindeman, and I am a licensing and level of care specialist within the CFS licensing unit. Thank you for everyone who has joined this evening. I've worked with many of you in different capacities over the years. It's nice to see some familiar names and faces in the audience tonight. Once we get going, I will be exploring the topic of shelter care on call with you and answering any questions you may have. I'll turn it back over to Brittany.
Thanks, Dana. So we are going to start off first with respite care. So as foster care providers and case managers, you know that throughout the life of the case, we are managing safety and providing service, which is achieved by ongoing engagement and assessment that is conducted by the agency. And so respite care really, we may think of that it's for foster care, right? Respite is always for foster care, but truly respite can be for a child who is involved with child protection or in-home that's used as a prevention service. So respite is really a pre-planned arrangement that is available to a parent or caregiver who needs temporary relief care for a child who requires time-limited supervision. And that would be because of their special medical needs, some high behavioral health needs, and a provider may be requesting it to stabilize placement, or it's being used in the parental home to really prevent removal. And respite care really can be highly effective as a reasonable effort to prevent removal from the home and keep that child safely with family. Children who are eligible for respite. So you as providers may be called to provide respite care for children in foster care or children who are not in foster care and it's being used as a prevention service. So it can be for any child under the age of 18 who's involved in a human service zone. So child protection, in-home or foster care. Respite can also be used for the Division of Juvenile Services for children who are in a foster care placement. We would pay for tribal 4E foster care clients. We can also pay for post-adopt clients or post-guardianship. And so post-guardianship, what is different about that is they do not have to be a department subsidy recipient. As long as that family and child was involved in child welfare within the last 12 months prior to that establishment, guardianship could be utilized as an effort to stabilize that placement, or it can be used for human service center clients who are duly involved with one of the other agencies, such as a human service zone or a tribal nation. There are a couple ways that you as providers or case managers can request respite. So if we have a child who has high behavioral health needs or special medical needs or something's going on in the home, we can approve respite one of two ways. It can be up to 4 calendar days per week per respite care episode. Or if there's non-overnights and respite is just needed during the day, it can be up to 12 hours per week. And what's really nice about respite is there is not a limit on the number of respite care episodes a child could receive. So a child could have up to 12 hours a week throughout the life of the case, depending on the needs of that child. Or they could have up to 4 calendar days per week, again, depending on the needs of the child, the family, and the provider to help stabilize that placement. If you as providers are wondering how you could help out, even for a short period of time, if you want short-term placements, Respite is really one of those opportunities. So you as licensed foster care providers can provide respite to eligible children and be reimbursed through the CFS licensing unit. Respite can also be provided by licensed childcare providers. So as long as that childcare provider is licensed for the ages of the child that you're wishing to be served, CFS licensing can also reimburse licensed childcare providers. So what was nice with the creation of the CFS licensing unit is really understanding what we heard from providers is timeliness of reimbursement. And so when we have a respite request that is coming in, every week, Dana or I are reviewing them, and we are making payments to providers every Friday. And so for case managers who are looking for respite, it's important to know that that pre-approval for respite is required. So when you're looking for respite for an eligible child, as a human service zone, Division of Juvenile Services, or a tribal nation, you would submit Part 1 of the SFN 929 to the CFS licensing unit in efforts to gain that pre-approval. And so there's always going to be a response within 1 business day of either asking more questions or approving that request for the child to have respite and be paid for by CFS licensing. And so if that request is approved, the case manager would submit the second page of the 929 after the respite care episode has occurred. And so this form should be submitted at least 30 days after the respite care episode has occurred. And so the 929, when it was created, has multiple spots for entry of respite care. And so there could be 3 weekends that are on there, and we would pay the provider all at once. And so when you are, as a provider, being talked to by your licensing specialist during either initial or renewal licensing, they're going to be talking to you about respite and if you're interested in providing respite. And so if you are interested as a provider in providing respite, your licensing specialist will be asking you to complete a W-9 and a blank voided check. And the reason that is because as a provider, unfortunately, North Dakota right now has 2 different payment systems for respite and shelter care versus where your actual foster care monthly payment may come from. And so we need it twice. And so those are the reasons that we would need that W-9 and blank voided check, is because we have 2 different systems and we want to pay you timely. And so during initial or renewal licensing, your licensing specialist should be gathering that information from you if it's still needed and it's something that you're interested in providing. And so you guys may be thinking, what is respite? Like, can you give me examples of what respite might look like for either me as a provider or me as a case manager? Like, when can I request this? And so respite can look multiple different ways. And so for instance, we could have a child who may be destroying property. That primary caregiver, such as a foster care provider, a relative caregiver, or the parents are just asking for help to regroup, and they're seeking some sort of relief. And so you as a case manager could submit the 929 to the CFS licensing unit in order to gain approval for payment. And so this would be an appropriate respite care scenario where a child needs a break, the provider needs a break, and we would be able to pay for respite care for up to those 4 calendar days per week or 12 hours per week, whatever you as a provider or case manager feels is best. Here's just another scenario. So we could have a relative caregiver who's caring for a medically fragile infant who may be a substance exposed newborn. The child is really inconsolable and is requiring 24-hour care. Those caregivers are needing a break to regroup, And that case manager is really seeking respite care to meet the child's needs, manage that placement, and support the relative caregivers. This would absolutely be an approval for respite, given the child's medical needs that could be taxing for the provider. Here's a respite scenario that could be utilized with, a CPS or in-home case. We have a mom who's caring for 2 of her children. There was a recent child protection assessment, and that CPS worker is identifying that those children require extra supervision and are having tantrums that can last for hours at a time. That worker realizes mom is stressed and mom would benefit from a weekend of respite each month to provide relief and support to her and really prevent that removal and stabilized placement for children in the home. This is a scenario of a prevention case where you as a provider could be called to provide respite for a child who is not in foster care. And we're going to hear later in the presentation from case managers and foster care providers around the state who are doing this today and how it has impacted them. So one thing we've kind of heard, I think historically, is respite care being used across the board for any scenario. And it's really important for case managers and providers to know that there are scenarios that are not respite. So we have what is called substitute care. And so that's when a child's in foster care who is placed with a licensed provider is in need of temporary care when the foster parents are unavailable to care for the child. And so this really means when we have a foster care provider who's maybe going on vacation, or they're going out to eat, or they're going to a basketball tournament and they just choose not to take the kids. This is not something that is reimbursed through the CFS licensing unit. This would be something that the child's custodial case manager must approve for substitute care arrangements. And so we probably have providers across the state who do this all of the time today. And so if we have a provider who's going out of town for a wedding, they may know another provider and they're going to contact that child's custodial agency to obtain that approval to find substitute care first. So we have licensed provider A who is going to contact licensed provider B. That provider is going to agree to take, 2 3-year-old twins for the weekend. And those providers are going to work together to say the daily rate for 3-year-olds is $28. We're going to be gone for 2 days, and I'm going to pay you as a provider $112, which is my daily rate because I'll be gone for those 2 days. And so this is, again, not something that's required by foster care policy, but is something we see historically done with providers across the state. Something else that can happen in substitute care is if you as a licensed provider are going out of state for a week and that child has an identified relative or a relative of those children in foster care and they have offered to watch the children, if the custodial agency agrees that this is the most appropriate placement for the child, those children can be placed with that identified relative or relative while you as a provider are going out of state. But this is not a scenario that would be approved for respite. So we're going to hear in the next couple slides just from case managers and providers who are really doing amazing work with children and families. And so these case managers and providers are going to talk about utilizing respite care as an ongoing prevention service and why they have felt it was beneficial. And so our first case manager spotlight is Justine Braun from RSR Human Service Zone.
Separating this family unit into foster care would be detrimental to the children. They rely on each other for so many different reasons in so many ways. Mom was specifically asking several times for foster care. So again, when we went back to the respite care piece, and it, like I said, it was a hard sell. It wasn't, she was nervous. Naturally, as a mom, we're nervous about who's going to be taking care of our kiddos. And she asked if she would be able to meet the respite providers. So she had specifically asked about, what are they going to be doing? And I said, well, whatever you want the respite providers to work on. And she said, well, just, maybe that's helping them do the dishes or cooking tacos and things of that nature. And so when I had brought up this idea to respite providers, they were really open to those ideas and suggestions. Respite care is providing these children specifically with opportunities that they wouldn't have had otherwise. Respite providers have been great about meeting these kids where they are at and focusing on everyday skills such as cooking, cleaning, and self-care, while also bringing them to community events and allowing them to participate in family fun activities, such as the school carnivals and things like that. Some things that kids talk about most after respite care includes the wellness center, going to the circus, and shopping at Shields. Respite has also provided each child to have more one-on-one time, whether with the respite provider or at home with their mom while other kids go to respite. I would say that, even if she's able to accomplish one task while the kids are gone, I call that a win. And I know that mom is definitely thankful for all the opportunities that her kids have been given, and she recognizes that they wouldn't have had those opportunities otherwise.
Here is Jolene Rod from Rough Rider North Human Service Zone. Jolene's going to talk about her experience as an in-home case manager, utilizing respite as an ongoing prevention in one of her in-home cases. She's really going to talk about her opportunities and the benefits of respite that she has been, or that she's seen with a family that she's working with.
So the child is learning that other homes have rules and expectations before fun, just like theirs. And the child is getting time away so that when working with community support, the time spent together is more meaningful and productive. The parent is also getting some time to transition to different parenting methods that they have not tried in the past. And the break helps to make the time they are together a more positive experience for both.
And this is Megan. She is a stay-at-home who is going to tell her peers about her experience providing respite care, again, as that ongoing prevention, and why she feels it's beneficial that we give families at that prevention stage the option to utilize respite.
I guess what we hope is that it kind of prevents any continued involvement with the social service system, or needing to actually take formal court action or doing any kind of removal or things like that. We were asked about it. I thought, that sounds kind of fun, right? Like, it's not a long-term commitment. It's just like, oh, you get just extra kids in your house for every now and again. Like, to me, that's enjoyable. That's a fun experience. And I think it's fun for my son. And he asks about the kids that have been in our house, oh, when are they coming back? Or can they come play this weekend or whatever? So to him, it's just kids that come over and play, right? And I hope to those kids, it's just sort of like, oh, we just get to go have fun. You can worry in your head about, like, okay, can we really take a 17-year-old who's going to graduate from high school? Can we really take a 7 and 8-year-old who are, maybe leaving another set of siblings and whatever? What's this going to, but until they're actually in your home and you're like doing it on a daily basis, you don't know how you're going to, because you would just think of all the worries, right? But then once they're actually there, they're just kids, like they just need schedule and routine and food and shelter, and in the end, like that's all that they need to sort of get them to whatever is next. But it's been a hugely positive experience. Of course, my husband and I were worried because we don't know what it's like to have a teenager. You know what I mean? Like, our son is 7. Like, we're not supposed to be parents of a teenager for many, many years. But I think what I just kind of always go back to is, we have a safe home. We can provide routine. We can provide support. We can provide guidance and love. It's like being able to be the fun parent, any of this, and hopefully that's what happens, prevents any court involvement or anything from ever having to come before a judge, nobody's going to be sad about having less juvenile court cases. I guess what we hope.
Okay, so everyone on their screen is gonna see a myth or fact. And so we are gonna have a poll pop up. And so I want you guys, everyone on the call, to participate. So is this a myth or a fact? I'm a case manager working with a family due to an open CPS assessment. I realize the child's high medical needs are taxing for the parents. I can refer the child to the respite program to give the parents a break and prevent removal. Is that a myth or a fact? You guys are answering fast. We have 95 responses with fact. You guys are correct. And so the reason that this is a fact is a child who is receiving services through either in-home or child protection are eligible to be referred for respite care services provided by a licensed foster care provider. We have the policy reference. So we're gonna have a couple of these. We are gonna hope for more than 96 answers for the next one. Myth or fact? I'm a foster care provider who is licensed for 2 children. I have 2 long-term placements. I am currently full. Due to being at my license capacity, I am unable to provide short-term respite or shelter care. Myth or fact? Okay, we're at about 80-20. And so this is actually a myth. Was it? The reason that this is a myth is because as a licensed foster care provider, you are able to use temporary bed space for no greater than 7 calendar days, not to exceed 6 children in foster care when providing respite or shelter care. And so temporary bed space that can be used for less than 7 days could be a pull-out couch. It could be an air mattress. It could be a trundle bed. It could be a pack and play. And so if you're asked to provide respite and you have temporary bed space, we would grant a waiver on the SFN 929 that custodial case manager or worker is filling out to provide respite care. Here are the licensing policy references and then the forms that waive the bed capacity. We have one more for respite. I'm a foster care provider, which means I can only provide respite or shelter care services to children in foster care. They're still coming in. Okay, this one is a myth. This is a myth because as a licensed foster care provider, you could be contacted to provide respite or shelter care to families who are being served through CPS or in-home, as that prevention and early intervention to keep children safely with their families. And so this is important. We're really trying to hit this home with the CFS licensing unit that respite is not only for children in foster care, it is available for those who are also being served through other programs as at prevention. Here are the licensing and case management policy references. And we're going to switch gears to shelter care. And so we're going to talk initially first about shelter care in a family home, and then we'll switch gears at the end to talk about certified shelter. And so you guys may be thinking, what is shelter care? And so shelter care really can be utilized when out-of-home placement is required to control present danger in the home. Case managers are planning to control that present danger or impending dangers when managing child safety. If present danger exists and out-of-home placement is warranted, agencies really have options to consider during that initial assessment of present danger in lieu of seeking that temporary custody order. So agencies first and foremost are going to try to identify and provide in-home supports. They're going to identify or locate any relatives to care for the children, or they could utilize a licensed foster home as a shelter care placement. So a shelter care placement in this scenario does not require a temporary custody order if those parents are agreeing to that out-of-home safety plan while in-home supports and services are put in place. This is really utilized as a diversion from foster care while the agency is managing the present danger and trying to control the threats to the child. As of July 1st, 2023, we have increased the rate for foster care providers who are providing shelter care. So for those prevention cases for children who are involved with the human service zone, again, it's those CPS or in-home cases. In the cases where there's no temporary custody order that's obtained and they're using it as that diversion, the rate is $55 a day. And so it can be up to that those 7 calendar days. If the child and the agency, or if the agency does obtain that TCO and the child is in foster care for greater than 24 hours, those cases are federally required to be in our AFGARS data, and those cases must be entered into our data management system. And the provider, since the child enters foster care, would be paid the foster care daily rate. Placements for shelter care cannot exceed 7 calendar days. So during that time, the agency is working to mitigate the present danger. They're identifying relatives or in-home supports, or they're determining that court intervention may be required. A present danger plan can be in place for 14 days. And so if an agency is looking to go past 7 calendar days, department approval is required in those prevention cases. That's not to exceed the 14 calendar days. You as providers have this option to provide this service to children in your area and throughout the state. You are an option, so are licensed childcare providers. So for instance, if you as a case manager have a removal in the morning and you're able to locate a childcare provider and you're able to identify family by 4 p.m., if that child does not enter foster care and there's no TCO, you could submit the SFN 931 to the CFS licensing unit, and we would be able to directly reimburse the child care provider. As providers who do this, your licensing specialist during those initial and renewal licensing time periods is talking to you about requesting and providing shelter care. And so if you as a provider are interested in providing shelter care, your licensing specialist is going to have you complete that SFN 928, which is just the agreement to furnish shelter care. And so if you are a yes to shelter care, you're going to be placed as a yes on the provider list, and custodial agencies are able to see that you're able to take those emergency short-term placements. As stated before, just kind of like respite care, we would need a W-9 and blank voided check. If we already have one for you, because you said yes to respite care, you would only need that one W-9 and blank voided check. Two would not be needed. And so if you've already said yes, we would already tell you that we have this and we wouldn't need another one. I'm going to turn it over to Dana to talk about shelter care on-call.
Thank you, Brittany. Now you may be wondering what it means to be a shelter care on-call provider. Shelter care on-call providers offer short-term, safe care during a time when present danger has been identified and a child is needing a safe bed outside of their home. On-call providers receive a $100 retainer for being on call, and if an emergency on-call placement occurs, the provider will receive the daily rate per child placement. The daily rate, like Brittany said for shelter care earlier, is $55 a day, and the daily rate for foster care placements is varied and based on age. On-call is a period of 7 calendar days, beginning at 12 a.m. on Friday and ending the following week, Thursday at 11:59 p.m. During that 7-day on-call period, providers must have permanent or temporary bed space available for at least 2 children ages 0 through 17. Placements may occur at any point during the 7-day on-call period, and placements may continue in the provider's home beyond that last day of the on-call rotation, depending on what day the child was placed in the home. Day 1 of placement begins that first calendar day a child enters the shelter care on-call home, and placements cannot exceed 7 calendar days unless approved by the department and agreed upon with the provider. Shelter care on-call is a front-end service, and when used as a prevention, children are diverted from entering foster care. Eligible cases are those children and families involved with the zone through child protection or in-home case management, where a TCO has not been obtained, but present danger is occurring and the children are needing temporary safe care. Emergency placements from a human service zone where a TCO has just been obtained, or where law enforcement has just placed a child into protective custody, also meet shelter care on-call eligibility. CFS licensing manages the on-call schedule. I am the primary contact for shelter care on-call and the scheduling. When creating the schedule, I reach out to current on-call providers with open and available weeks, and providers are able to select any week that works with their schedule. We have providers who sign up monthly for on-call. We have some who sign up every other month or less frequently, depending on their availability and scheduling conflicts that may present. At the conclusion of the on-call week, I follow up with providers, checking in on utilization rate and to answer any questions related to shelter care on-call. The on-call schedule is available within the HHS intranet. This is where the Human Service Zone finds access to the schedule for on-call providers throughout the state during the current week, along with contact information and the provider's approved on-call bed capacity. As far as reimbursement for shelter care on-call, if a shelter care on-call placement is made because of a prevention case, CPS or in-home, the zone case manager will complete and submit the SFN 931 to CF licensing, requesting reimbursement after the shelter care episode concludes. CFS will then issue payment. Payments are issued every Friday, and the daily rate, once again, for shelter care on-call placements is $55 a day. If a shelter care on-call placement is made and the child enters foster care for greater than 24 hours, the zone will open and enter the placement into the child welfare data management system, and payment will be made from our foster care payment system. And once again, the daily rate varies and it's determined by the child's age. The on-call retainer is also reimbursed weekly. It's reimbursed to the provider the week following the on-call schedule. There's no state form needed or additional paperwork on the provider's part to trigger that reimbursement. This is something that is tracked internally by CFS licensing. So who should you contact if you have questions? Maybe, after hearing a little bit more about shelter on call, something may have presented as far as a question or wanting to know more information. So if you're interested in providing shelter care on call, you have questions related to the program in general or payment questions specific to shelter care on call, please reach out to me or Brittany by email or give one of us a call. Our contact info is on the screen and one of us will be able to answer any questions you may have. So now we will hear from one of our experienced shelter care on-call providers, Ryan and Kate Jockers. Ryan and Kate live in Mandan and they are seasoned on-call providers. I had the opportunity to interview Ryan and Kate about their experience as shelter care providers and asked if they had any initial fears, worries, or hesitations about being on call. Also asked if they have any advice to offer those who were considering providing on call. So let's take a listen.
For those that are just trying to get their feet wet, they want to kind of get a feeling for what this is like. It's a great way to do that. I know Respite's an option too, but this is another option to plan ahead and say, hey, we're going to be available for this week. We're going to be ready for a call. We're going to have a room or a bed ready, and we're going to try it out. Getting at least one and seeing how it works. And they're like, okay, this isn't so bad. So I would tell them, the people that are maybe afraid, is just, sign up for a week, plan for it, prepare for it. Make sure that your schedule is somewhat flexible that week and just give it a try. And just be ready for a call and be ready to help out and just see what happens. It's not like you're committing to a year, you're committing to 1 week. So just try a week out.
Okay, so next we will look at an approved scenario, an appropriate scenario for shelter care on call. Due to present danger in the Smith family home, the agency is seeking temporary out-of-home placement. Throughout that assessment process, grandma is found to be living in Minnesota and she's involved with the family and available to care for the children, but she cannot arrive to the home for 3 more days. The parents agree to an out-of-home safety plan and the case manager places the children into a licensed provider's home and requests to utilize shelter care funding. This diversion does not require the agency to obtain a TCO and the children do not need to enter foster care. The safety plan is for grandma to arrive and assist with in-home supports and services for the family, and the case remains open as an in-home program and will be monitored accordingly. So this was a scenario where shelter care on call was utilized. Children were provided that safe temporary bed and allowed time for the family to travel from out of state and eliminated the need for a TCO and children entering foster care.
Hey, Dana, there's a couple questions in the chat. I'm wondering if you want to take those on.
Okay, let's see. Let me see if I can see.
Well, I can read them to you. The first one says, I am a CPS worker and was wondering what the protocol is for human service zone workers. Should we be calling the on-call list first? Or are we able to call the foster homes near us first?
I guess that's, your preference. The on-call providers are there for those emergency situations. But I guess if you're wanting to utilize other providers, you certainly can do that as well.
Yeah, and so I think that's a really good question. So in certain scenarios, we have on-call providers. Our goal is to have, 4 throughout the state, but in some cases, you as a CPS worker could know that it's like the nearest on-call provider is 45 minutes away. If you choose to, you could filter on the North Dakota provider list and look within your zone to see which ones are a yes to a shelter care emergency placement. And you would be able to see that you have several families who are willing to take those emergency short-term, but may not be willing to be on call.
Second question, I'm hoping that answered Rachel's question. If not, Rachel, let us know. The second one comes from some other additional foster parents. As an on-call home, if you are licensed for only certain ages, how does that work? Is that licensed approval waived? And what if the child needing shelter care is a danger to other children?
And so as a shelter care, if you choose to be a shelter care on-call provider, we ask that you have availability to take those 2 children and have bed space for 0 to 17. So you have bed space for an infant, or you have bed space for that adolescent child. As that shelter care provider, you're still able to ask those questions. What are the symptoms and behaviors the child is displaying? For instance, if the child is under the influence, as a provider, you should be asking, has the child been medically cleared? Has the child been seen by a medical professional? Those are all appropriate questions for a provider to be asking of the case based on what the child symptoms and behaviors are, what the CPS workers in some cases may not have all the answers. They're there. They were called in a crisis situation and are going to answer those questions the best they can.
Okay, hopefully that answered that question as well. There's an additional one that just popped up. If I work full time, am I still able to be on call, or would I need to be off work that week?
You are able to work full time. Actually, I would say 90%, if not more, of our on-call providers do work full time. Childcare is something that is reimbursed during that period of time when you would potentially have children in your home. So I think, working with the zone, arranging childcare, transportation, those logistical things are something that, occurs. But yes, absolutely, working is not an obstacle for providing shelter care on call.
Okay, an additional follow-up question to that second one is, I believe they're asking, can an on-call say no to a placement?
So if the on-call provider is there, they should be saying yes to the present dangers, that's a prevention, and to those who are tamed where the agency obtains that temporary custody order. Those should be yeses. If you're contacted by a human service zone to take a child that does not meet that scenario, so for instance, we have a child who may be disrupting from a placement, that is where you're able to say no.
Great questions. That's all we have in the chat for right now.
Thanks, Rachel.
Okay, we have a second approved scenario for shelter care on-call placement. Law enforcement pulls dad over for speeding and there's a warrant for his arrest. There are children in the car and CPS is contacted to assess the situation. CPS visits with dad, identifying no family or friends to care for the children. It is known that dad will be released from jail early next week, and CPS asked dad if he agrees to an out-of-home safety plan where the children could reside with a licensed provider over the weekend. CPS places the children in a licensed provider's home for 4 days and requests to utilize shelter care funding. This diversion does not require the agency to obtain a TCO, and the children do not need to enter foster care. CPS remains the point of contact until dad is released and the children are returned to his physical custody. So again, another situation where on-call was utilized, providing that safe temporary care when a parent is unavailable for a short period of time and diverting from foster care. So we have another case manager spotlight. This is Alyssa. She is a CPS worker from Dickinson, and Alyssa will be talking a little bit about her experience utilizing shelter care on call when she was conducting a CPS assessment. So let's take a listen.
We utilized shelter care to give mom more time to find safety supports, and we still felt we had present danger revolving around the psychological maltreatment. So to stay away from taking the child into foster care, we went with the shelter care on-call home. I would say mom was skeptical at first because she didn't see the difference, but once the difference was explained to her, she was more open to everything. Working with mom was different because I feel she could tell we were really working with her and not against her. I think we were seeing mom make changes in her parenting approach as well as her honesty and vulnerability with us. Had we taken the child into foster care, though, I think that would have been very different. Mom agreed changes couldn't be made if the child was in foster care and not in the home at all. Every weekend, the child was going to the same respite home after that on-call shelter care was ended. The home was actually the shelter care on-call home that she went to, and the foster parents were on board with long-term respite care. I think that week of shelter care together really gave the family a good idea as to whether the child would be a good fit for them for the ongoing respite care piece. less paperwork and no court involvement. The paperwork is very easy and kind of stress-free.
And I think what's nice about this provider or this scenario is Alyssa initially started working with this licensed provider as an on-call family. The on-call family had this child in their home for a period of time. And when the child was returned home, Alyssa really worked with that provider and the family to say, how else can we plan to ensure safety of the child? And would you as a provider be willing to be a support? And so this was twofold. They initially used the provider as a shelter care on-call, and then also implemented respite care for the child and family with the same provider. So it was really nice work, all the way from the case manager to the providers working together for the child and family.
Okay, we have another myth buster, this time related to shelter care on call. Are you able to launch the poll, Brittany? Okay, thank you.
Rachel's getting there.
Oh, okay. All right, thank you. So I am a shelter care on-call provider. This means I must accept placement of children ages 0 to 17 for no greater than 7 calendar days. For children who are removed by a temporary custody order or a prevention case where parents are agreeing to an out-of-home safety plan. Myth or fact? Okay, we're at about 50 and climbing responses. Okay, we're at about 80-20 with 80% saying fact. And that is correct. It is a fact. A provider who is on call must accept placements not to exceed their bed capacity, including children who are removed by a TCO or when parents are agreeing to an out-of-home safety plan for no greater than 7 calendar days. And there we are referencing our provider agreement, the State Form 928. Myth or fact? I want to be a shelter care on-call provider. This means I must be able to take up to 6 children in foster care. Okay, we're at about 70 responses, climbing pretty fast, and looks like we have about 98% saying that is a myth. And that is correct. That is a myth. An on-call provider must have at least 2 bed capacity during their on-call rotation, permanent or temporary, to accommodate emergency placements for ages 0 to 17 that may occur. A provider may not exceed 6 children in foster care while providing temporary care, including shelter care on-call. And there we have our policy reference. So I will now hand it back over to Brittany as we wrap up tonight's training.
So what you guys see on your screen here is really a one-pager for case managers and providers and really determining what is shelter, what is respite, and what is substitute care. And so this handout will be available on, I'll email it to Amy so it's available on the CFS website. And so it really goes through what the definition is, what the length and duration means, how its substitute is different than respite care. And so this is a really good tool for providers and case managers to understand the differences between each of them. On the bottom, we give scenarios for a shelter care placement, a respite care placement, or substitute care. And so when you guys hear I need respite, it's like, is it respite based on, the child's special medical, emotional, or behavioral health needs? Or is it because I'm going to a concert? There's some differences there. And so it's really helpful that we're all using the same language, so there's not confusion among providers, case managers. And so the last thing we want to talk about tonight is certified shelter care. And certified shelter care programs were implemented as part of the 2021 legislative session. And so during that session, lawmakers approved an expansion to emergency shelter care options for children and youth. And so certification by the state really means that certified shelter care providers are meeting safety and service standards and then can be reimbursed for the services to children. The intent of certified shelter care programming is to be used as a prevention and early intervention tool to address immediate placement needs while supports and services are put into place for families. Certified shelter care programs offer that temporary placement option to support child safety while really helping to strengthen and stabilize families. And certified shelter care is available for a period of 7 days unless that extension is approved by the department for an additional 7 days. And certified shelter is managed by an agency. It's a non-secure permanent dwelling that employs staff 24/7. And there are eligibility criteria for certified shelter care. And so eligibility is for children who are ages 10 through 17. You could have that child involved with the Division of Juvenile Services, a tribal nation, a human service zone, or they could be placed by that human service center mobile crisis unit. And so again, that prevention, there's no TCO obtained. It's that CPS or in-home case management. And they're using it as that diversion and early intervention when that present or impending danger exists. And what's different from certified shelter versus shelter care in a family setting? The CFS licensing unit has a financial contract for placements made by the department. So placements that are made by the Human Service Center. All other placements are reimbursed by the placing agency. So if a human service zone is placing a child into a certified shelter, the certified shelter is going to bill the human service zone. If it is a child in foster care, it would still be put into the data management system, but it would be a placement that's entered as non-foster care because it is not a federally, it's not able to be federally reimbursed by foster care funding. And so as we think about what a certified shelter care scenario might look like, it could look very different from a human service center who is placing a child who they're trying to mitigate a mental health crisis versus a human service zone or a tribal nation. And so for instance, for a child who could be placed by a human service center, that child may have no involvement in child welfare. They may not be involved in any CPS in-home or foster care. A child could simply be receiving services at the local human service center, and that child's parents is calling 988 because the child's experiencing that behavioral health crisis at home. The Human Service Center crisis team would respond and they would recommend that the child, so if they're assessing the situation, they could recommend to the parent or guardian that the child would benefit from a night away. That caregiver would have to agree to the recommendation of the crisis team. And so if the caregiver does agree, the child can be placed at the certified shelter care program. And the human service centers are required to follow up every 24 hours with the child, family, and certified shelter to ensure discharge planning and that continuity of services and supports are available upon that child's discharge home. Again, it could look very different if there is an open CPS case and during the CPS assessment or during that in-home, if there is present danger that is arising, that child protection worker or case manager really could explain what certified shelter is to the parent or guardian, explaining that a night away could benefit and really use it as that diversion and early intervention to support the child and family and prevent foster care involvement. The discharge planning would begin upon admission, and that CPS or in-home worker would ensure that the continuity of services and supports are available upon the child's return home. If you guys have questions about anything that was talked about tonight, please feel free to reach out to Dana or I. Our emails are on the screen and so are our phone numbers. We would be happy to talk through any questions that you guys have. If you have general questions about anything else, you guys are free to contact our unit centralized inbox, and it will be routed to the correct point of contact. Rachel, are there any other questions in the chat that I can't see?
No, not as of right now.
I'm seeing one that just came into me privately. So Question I have here is, on average, how many placements are made during a week of on-call? Good question. So folks maybe know what they're kind of getting into. Average is put out there, so we know whatever you say, Brittany, isn't like the end.
I'm going to turn it over to Dana because she actually talks to the providers every Friday about utilization, and she would have a better number.
Yes, so it varies, as we all know, in the world of child welfare and placements. But I would say that, you know, we have weeks where providers, I'm kind of looking at my utilization rate tracking right now, and there are several weeks in the last month and a half where providers did not receive any calls or placements. And then there are some times, of course, when providers do receive a placement, but I would say that more times than not, what I'm seeing is that there have been no calls or placements within the last month and a half that I'm just looking at the data. So, you know, sometimes a provider may get a call and say, hey, this is the local zone. I have an emergency placement, giving you a heads up. And then maybe, you know, an hour later, they'll call the provider back because family was found. So, you know, they may be getting a call in that aspect, but, you know, after further assessment, family is found. So I am seeing that when providers are getting called, but I would say more times than not, providers are not being called.
There is another question too in the chat. Can we get tonight's training slides? Are those going to be available after the training?
Yes, they will be placed on the CFSTC website for sure by the end of next week. If there aren't any other questions, again, feel free to reach out to Dana or I individually, and we would be happy to have a conversation with you. Thank you guys for attending.
Have a great evening.
Thank you.